my name is Dr. Hans. In 2000, I received my MD and started on a path of internal medicine and infectious diseases. In 2017, my son received a diagnosis of SYNGAP1 syndrome, and I became a rare disease advocate. And in 2021, I joined industry in order to work on rare diseases as much as possible. And I love talking about rare diseases. Today, I'm going to talk about goals. So, in referring to goals, I'm talking about the big picture sense for the disease that you have a passion for, but then also the personal level. For the big picture, the first thing that comes to mind is establishing what the cause is, because it absolutely is vital to understand it. It's not obligatory, it's not necessary. You can look at the Castleman's disease world where they have treatments to dial down the immune response, but they don't know what's driving it in the first place. So understanding the cause is very, very important, but don't get, despondent if it's unknown. Treatments are still possible. And in order to figure out what the cause is, I would direct you to the Progeria Research Foundation and their efforts to tease out the cause of progeria and the LMNA gene. The fact is that you just don't need to reinvent the wheel. You can copycat from others that have led the way. And PRF has done a fantastic job in advancing the causes of treatment there. And it goes much even further beyond just establishing the cause, but illustrating, gene editing in a mouse and what's upcoming for them. Then another critical part of it is a mouse. And we saw this in the PBS documentary, The Gene and Intimate History, where you see the efforts of the KIF1A community and we need a mouse, because developing a treatment in the lab hinges on the efforts in mice. To be able to demonstrate that something works in a living organism is critical to making progress towards a human treatment. Now, as I mentioned earlier, Sonia Vallab and the efforts in prion disease are a great illustration of what someone is going through. And earlier this year, there was a paper in Science where a industry executive essentially gave them a to-do list and said, if you want to have as quickly as possible an impact, you want to do three things. You want to have a mouse demonstrate that it lives longer with treatment compared to the untreated prion model mouse. You want to have a registry of patients available so that you can demonstrate an ability to organize your community and enroll clinical trials quickly. And thirdly, you want a biomarker, a readout that gives a researcher, an observer, a sense of whether or not the treatment is working more quickly than testing the animal, watching its longevity 6 months, a year and a half down the road. Time is money, and time is neuron and life and everything. So those three things are the next sort of kit in making your way towards treatment. The SYNGAP community is very fortunate. We have researchers like Gavin Rumbaugh, who in 2015 and 2019 was able to demonstrate that correction of the deficiency of SYNGAP improved the phenotype, improved seizures, etc. We had already had a mouse developed earlier out of the Huganier lab, so that was taken care of. But then demonstrating that you could treat a SYNGAP mouse was key. And that also was published in 2024, this past summer, when Joe Anderson's treatment of ex vivo lentiviral correction showed benefit in the mice. When it comes to a patient registry, sort of in that to-do list, to me that falls within the purview of a patient advocacy group. A social butterfly of an individual can certainly collect that, and I've always called it a Rolodex. The idea that you can interact with someone who says, part of a company, we're interested in missense variants in the first third of the gene. And then you flip through your Rolodex and you say, okay, I've got Timmy, Billy, Jenny, and Sally who have missense variants in that first third. I can reach out to them, maybe get you guys connected, maybe it'll turn into some patient samples and research. Great. So that Rolodex is critical. And also, the SYNGAP community has been fortunate in the sense that we have had a patient advocacy group since 2014 in Bridge the Gap, and then what became labeled sort of the SYNGAP Research Foundation, and in 2018, the SYNGAP Research Fund. Now, when it comes to a biomarker, this is a little bit more challenging to talk about just because I wouldn't want to consider myself an expert in EEG. It's a pretty challenging modality, but you see the publications for SYNGAP, you see references to interictal spiking improving and other readouts and the different types of EEG, whether it's research grade or not research grade or so forth. So there's hope that EEG is going to be a biomarker as a readout in clinical trial work for SYNGAP. There's also a very intense effort to identify plasma markers as well as potentially CSF markers of SYNGAP. So hopefully that is going to be a tool in the toolbox for SYNGAP clinical trials. You can see how important it is, in terms of, earlier in 2024 when Elevidys was approved for the Duchenne's community, and how Peter Marks's memo cites biomarker data as being persuasive for him, or part of the totality of evidence that he was taking under consideration. So I hope you've already seen that TED Talk that I mentioned from Sonia Vallab, but unfortunately we have this in the way. But the structure of the molecule was the first thing she was worrying about, and then it expands, right? So her to-do list ramped up and exploded. But take a look and familiarize yourself with this, because you're going to be knee deep in it, neck deep in it, if you're tackling a rare disease. Now, when it comes to the more personal sized goals, it happens quite quickly as a physician that you learn to manage expectations, right? You're dealing with a family whose loved one is in the intensive care unit, and they may have different expectations for what is happening and what you expect to happen. So, for example, I am dealing with a son who I suspect is really an extreme case of SYNGAP1 and its intellectual disability. So he is unable to express himself verbally. So his expressive aphasia is complete. I've heard him say one word, and that was more when requesting further pushes on a swing. And it's been a few years since that's happened. And there's a degree of, seizure activity as well, sort of eye flutters, these eyelid myoclonia with atonic response or atonia. The atonia part went away pretty quickly with medications. The eyelid flutters persist and are quite challenging. And then there's also behavioral issues in terms of he will get frustrated quite quickly, right? So if you say no to him or he doesn't get what he wants right away, so he'll start, let's say, biting. He may do it on his own arm. He may grab anybody within reach, including a little sister, which has etched its visual in my brain and makes me cringe. But if I had to guess, I'm estimating, if moderate to severe intellectual disability is an IQ under 50, boy, we're in the 20 to 30 range. He also has microcephaly, micro meaning small, cephaly meaning head. And what happens here is you take the measurement around the forehead and around the remainder of the skull, and compare it to a cohort of similar age. And less than 1 percentile means we're not working with a lot. And I presume that he has essentially less neurons than a typical 9-year-old Syngapian who maybe is less severely affected. I worry that this translates into issues down the road, that the dose of one medication for one kid is spot on and corrective, whereas for my kid it could be over the top, let's say, if he has less neurons to treat, or maybe it's underdosing. I don't know. Researchers have got to get that dose correct and personalize it, and hopefully the biomarkers help there. When it comes down to it, my goals are very similar to the patient-focused drug development forum that was held with FDA for SYNGAP1 a few years ago, where the participants established that cognition, and particularly as communication, is the most important goal to them, and then seizures, and then behavior. So you can imagine it's clearly very similar for me, where I'd like to see improved communication, improved cognition. If I can understand what YouTube video he wants, if I can understand what meal he will eat, that he will prefer, instead of making 3 or 4 different entrees and then eating them all myself, it would be great, right? Keeping him happy. When it comes to seizures, it would be great to bring those eyelid flutters down and make them go away completely. There's a lot of neuroscience that I don't fully understand in terms of, the correction at the neuron level, the correction at the networking level, and the organ itself being optimized. But hopefully seizures are improved just with SYNGAP replacement, as is seen in the mouse models. And then for behavior, I don't think I can really complain compared to some of the other parents and other kids that are affected, adults that are affected when it comes to behavior. But I'm just hoping that I don't make matters worse, right? The idea that, at 3 a.m. you wonder, can I make this even worse in some way? Worrying for the sake of worry almost. Now, when it comes down to it, I have to manage my expectations, right? We discussed this when we were doing azithromycin and Adalurin for nonsense read-through, we being his doctor and I, that there are potentially windows of skill acquisition, right? That kid around the age of 1 starts to open up that window of verbalization with their babbling and then the words coming out and stringing them together over time and so forth. Does that window close? Does it close permanently? I'd like to believe that even if we don't get words, we're going to have an improvement in expression, right? Maybe through the assistive communicative device that he uses, which seems more for entertainment possible, usage at this time. But in some way, him getting across his needs. I have to also take heart in what's being seen in other trials, right? That sort of at the vanguard, you've got Stoke Therapeutics in Dravet syndrome, you've got Ultragenyx and Ionis, all of them heading to phase 3, enrolling phase 3 in Angelman's, where you've got reports from the phase 2 interactions with FDA of improvements in cognition, improvements in behavior, improvements in seizures. Hopefully also an improvement in muscle tone. My little guy has had about 5 pneumonias over the past year. And boy, I would really like to see them go away. We've seen a couple of deaths in the community from pneumonia, and I don't like to talk about it. So Stoke, Ultragenyx, and Ionis, and those communities are really blazing a path, and hopefully the SYNGAP community sees similar gains in cognition, gains in behavior, gains in seizure control. Again, there is that 3 a.m. worry. We've also seen families and patients at the cutting edge, like the KCNT1 girls, where dosing with an ASO caused hydrocephalus in both the girls. And sadly, the one described, Valeria, passed away. It did allow an adjustment to dosing, the presumption being that this was a dose-related side effect. And I believe, I mean, at least I haven't heard that the second girl is okay and hopefully doing better, even on a lower dose of her ASO. And, you know, we have to live with these risks. I have come to terms with the risk. My better half has given me the okay. I've never spoken to, other families that have been in these circumstances and particularly suffered the dreaded outcome of their child passing away. At least through word of mouth, I understand that they are at peace with their decisions, and I can totally understand that. You're trying your hardest to help your kid, and there is a risk to it, but you're going to help. You're going to try to help. The idea that you leave no stone unturned, no avenue unexplored, and can live with it. This is beyond control and to some degree out of our hands. But we know going in that there's a risk. And at least for me, I'm hoping to demonstrate that SYNGAP upregulation replacement is safe in my little guy, right? That it helps him, that it's safe. And then from there, the next step is to ideally gene edit, right? To have CRISPR, base editing, prime editing, you name it, be able to correct that single nucleotide that sealed his fate. And to sort of reset the system back to what we call wild type, to neurotypical. The damage has already been done. Hopefully correction and gains continue. We know that earlier in life, for a mouse at least, is better than later, but later still has benefits. So I'd like to be able to show it's safe in replacing SYNGAP, then correct the system and let it internally sort of control its regulation. That would be more than I think I can hope for in my lifetime. Gosh, you just want to set goals, though. It's going to happen, right? We're going to do it. And interestingly enough, I had to do this a second time around, and in the interim, the ACG CT, the American Society of Gene and Cell Therapy, has got a webinar coming up in March, I believe the 12th and 13th, and I tweeted it out where goals are discussed. So I hope you hear that person speak on goals as well, because you want to hear what others are thinking, right? To form your own goals. And I think at this point, I'll wrap this up and say, I hope you find your goals. I hope you have reasonable goals and don't set yourself up for heartache. I hope that your goals don't consume the amount of time you have with your loved one, right? Priority number one is to shower them with the experience of care and love. And on that note, we should go get to that. Thank you. So now that the credits are passed, you know what happens after the credits. That's when the crazy comes out, right? That's when you've sat in your seat long enough that you expect to hear something interesting or see something interesting at the movies. And another goal, in a real big sense, is to eliminate SYNGAP as a issue. And when I talk about that, It's really alluding to a conversation, let's say in 10 years or maybe 110 years, where a healthcare provider approaches a pregnant woman and says, we can test your blood and see if your baby has a genetic defect. We'll get back to you in a day or two, and we can talk about the results and see if they're actionable. And a woman has this done, and the healthcare provider says, we did detect this SYNGAP variant. It's associated with profound intellectual disability and a lot of other things, but we can target it with personalized gene editing that we can administer quite quickly and effectively. It may need a second treatment based on the results, and we'll hope for the best outcome possible for your fetus then. The evidence shows improvements of X, Y, and Z. Now, by now you're like, right? This is science fiction, right? And it isn't, in fact. I mean, the fact is that you can see here, and this is earlier, just over a year ago in the New England Journal of Medicine, where they were able to do deep genetic sequencing of the fetal DNA simply from a blood test from the mom. It wasn't the only paper to come out in that issue, but a second academic center was able to also do that on their own, which is just fantastic, right? And now it's a matter of saying, okay, will gene editing be able to do that for us? And fetuses are treated all the time, right? If it's a surgery to correct spina bifida, meningomyelocele, if it's enzyme replacement therapy for Pompe disease, you're going to see that right here. So we naturally have a degree of hesitancy. It's got to be super safe. And I don't think people talk about it that much, because the last thing we want is to hear about, playing God and all that stuff. And for IVF, it took years upon years for the public to become used to it. Now gene editing and the setbacks of sort of cavalier researcher using CRISPR in China, it's going to take some time to warm up to. But nothing would make me happier than to prevent this disease impacting other kids and their families. You can see it in papers where mice are being gene edited while still in utero. It's happening. It works. And it should be our long-term goal to get rid of these diseases. All right? So thanks. I hope that was worth sticking around for.